More and more eating disorders, they have lifetime obesity. Frequently, children who started with an obesity, we have to pay attention that they are not developing an eating disorder, which is a common condition. And on the other hand, eating disorders who develop this problem, and they might be a risk to develop also obesity. So we may need to pay attention how to detect them. Eating disorders, they have lifetime obesity. Both conditions, eating disorders and obesity, are frequently present. In eating disorders, around 30 to 40% of cases along their life, they may have obesity, previously to the development of the eating disorder or consequently to the eating disorder. In the case of obesity, many cases they are going to have or they had a lifetime eating disorder. Between 10 and 12, 13%, they will develop that situation. Thinking in eating disorders, in those cases that an obesity is being present, they are going to show more symptomatology, higher psychopathology, and also sometimes poorer therapy response. In those cases with obesity that they may have an eating disorder, might be also poorer prognosis, and we may need to think so how the eating disorders may impact in more relapse. If your child has obesity, what you have to do is, of course, to look for specialized care, but also to pay attention about potential symptoms that may appear, such as relevance or importance about food intake, potential situations where there is a binge episode, how far they are losing the control about their eating behavior, and sometimes also trying to monitorize a little bit, but of course by means of specialized care, who is developing this reduction of body weight. In the case of eating disorders, especially bulimia or binge eating disorders, you may need to pay attention, of course, to the recovery from this disorder. But even when they have no those symptoms, they will still have an obesity due to this eating disorder. So it's important that then you pay attention to that, and then specialized care will be part of the treatment. In the case of if you have a child with an obesity and they have received some treatment, you have to pay attention to different aspects. That means, so on the first hand, are they having extreme concern about their eating habits, about their physical appearance, even in spite of reducing weight? There are some kids who develop a pattern which is extremely concerned about their weight, about their physical appearance, and although they have reduced 5, 10 kilos, they still are concerned about that. We may need to pay attention. We may need to pay attention. Are there any binge episodes or even some vomiting probably after this situation? If this is the case, so we may need to go for a specialized treatment. In the case of eating disorders who have recovered and they have probably bulimia or binge eating disorders, they might be recovered from the disorder, but they still have obesity. So we may need to look for specialized attention to increase lifestyles that might be healthy with regard to regular activity, also social activity, also implementing but also encouraging. So doing some activities that might be related to some sports, because it's important that although they have recovered from an eating disorder, they still need to reduce some weight. Besides of that situation, it's important also that they may have an emotional stability with regard to anxiety, to depression, that you look if they are having more isolation or less, if they are having normal social contacts, and probably also that they reduce a little bit the social media and the impact that this may have with regard to their body image and body weight. If you may have any further questions, please ask us. We will provide you with some answers, specific answers. If you like this video, give us a like, and of course you may subscribe also to our channel. I wish you all and your family a healthy time and all the best.